time. That's on time. I'm giving it to you.
It's early for me.
I'm giving it. That's what I'm saying. You're on time. I'm giving it to you. We had a 12 we had a crabby.
Oh, yeah. We had a conversation about it.
Yeah, so it was a while back.
Excellent. Thanks for coming.
Question. Just, I know I've asked you this before, and you should make it make sense. So the ambulance versus dispatch.
Yeah. So I have the time that the dispatcher picks up.
So that actually,
If you wanted to be the most like patient-oriented sort of number, call to arrival of the ambulance, call to arrival of the medical number.
not dispatch.
But what that includes, though, there is the dispatch component of it, actually getting to the ambulance, and then the process from whenever the call is walked to when and so right now, the responders are so excited to dispatch. Now, if we have a really EMS system in the rest of the county, I could start focusing on the call to live EMS or call to live. I could do things like have EMD and fires dispatch, dispatch, all sorts of things.
Like it's a dispatch company. We're on the street. Okay, and start being away to track one. We're taking the call. We'll let you know what we got.
Exactly. But standard
So we have to only if we're on the street. Before you order, so you don't open the air.
I mean, there's some debate about that.
No, there's so many times.
Quality doesn't because obviously by the time you're in the ambulance, you have like these guys would be like, oh, where am I going? Especially if they know is there a possibility you could get dispatched to call to not so you're like, oh, just go take it on that's fine.
You could even, I mean, this is just going from obviously some issues. If you're here, like your Charlie's Delta's not a those absolutely correct. You're on to a party one more.
Yeah, the only challenge with that is and so sometimes you can tell like yes, this is
It takes common sense.
yeah, right. To say they can't give you they can't
Nevertheless, they give us the keys to the game.
I had a discussion the other day about it. It's in the conversation phase about how to roll that out.
It needs to be down to the difference.
There's a fair amount of
Right, good evening, everyone. Welcome to the Poestenkill Fire Company, the informational meeting regarding ambulance service within the town of Poestenkill. Before we get going, notice the exits are with the for this facility. Exits are located in the front of this room here. Also in the back, restrooms are located in the back by the main doorway. Without further ado, I'd like to our panel here from West Sand Lake, Sand Lake Fire Department, Sand Lake Ambulance, from Albany Med, and our Rensselaer County Medical Director and our town supervisor. Gentlemen.
Dan, thank you very much. Thank you very much, one and all, for coming out tonight. As Dan was saying, this is an informational exchange. Craig and Tim are here from Sand Lake Ambulance. They'll be going over their proposal. Dr. Hayashi is here also. He'll make a presentation. but we're here to answer your questions. And we just ask that everybody stay civil, that questions are directed towards the front, and we will take everybody's questions as long as they're relative to this topic. And we're here just to exchange information. This is not going to be a hard sell. This could be an information sell. That's what it comes down to. We're trying to educate everyone and hopefully be able to forward, or if not, explain why. But again, I'm taking the time to come out tonight and bashful with your questions. Thank you.
He says me. Everybody, my name's Craig McMillan, and I'm the executive director of Sound Lake Ambulance. I realise I have an accent, so if you don't understand what I'm saying, Tim will translate for you. Tim Lash is our director of operations. We really just do everything together, and then Dr. Hayashi is our medical director. So just a little bit of background about where we're at as Sound Lake Ambulance, and then I wanted to talk a little bit about where things are at the county level, because I'm sure that's the topic of conversation, and then I'll sort of go over specifically about the conversations we've had with Tom about what we can do working with Poestenkill together. So about 2 years ago, well, you back up. I've been a paramedic for 35 years. I've lived in the town of Abel Park for just over 20. I married an American girl, that's how I ended up here. My full-time job now is at Hudson Valley, where I teach health economics and healthcare ethics. And about 2 years ago, Sound Lake Ambulance was in a particularly difficult spot. It was post-COVID, couldn't get staff, having a lot of problems, like, a lot of other stories that you've heard. So some folks there asked me if I could help out in any way, and then I sucked Tim into coming in and joining. And since the last 2 years, we've ran it together, and really, I think, got it back on pretty good footing from where it was. We have a good group of people now. We staff 24/7 with a paramedic and an EMT. Our guys do a really good job. We take really good care of people. And so we have it in a place where we feel like we've got it pretty stable, which is a major improvement on where it was. But, you folks all know that there's still pretty significant problems in the county, and we listen to the radio all the time. And, the reason that I'm here in front of you guys is, about 9 months ago, we had a 3-year-old turn up at our ambulance station in an ambulance from another town. And that child had been seizing for 45 minutes before they got to us. And so that's pretty heartbreaking for us to deal with. But it's terrible for the kid and the family. Like, that kid's going to have, real problems, can have real problems if he's seizing for that long, right? So we, had 3 paramedics and a doctor waiting for that kid when it turned up. And, the kid did well. But I mean, that's an example of what happens 5 or 6 times a day in this county, right? Is that people are not getting the care that they need, they're suffering. And, our collective effort is to try and do what we can to solve that. And obviously part of that is reaching out to the folks at Poestenkill and trying to figure out what we call a shared service, right? Something that we can do together that benefits both towns. And that's what I want to talk about, but I want to toss it sort of to Warren a little bit about where things are at the county level, what we've sort of tried to do, and he's got slides and numbers and stuff.
Yeah, I didn't bring up the slides this time, but you guys, I think, hopefully was able to get sort of the detailed information on call statistics. So I want to take a very brief step back. I just want to say that in this meeting, I am a medical director for Sound Lake Ambulance. I also am a medical director for a number of other agencies, including Rensselaer County Bureau of Public Safety. What I am saying tonight, though, does not reflect the Rensselaer County's position. I know that I just came from work, but I also do not represent Albany Med here. I'm really just representing, I guess, primarily my own opinions, and I guess a little bit I am the medical director for Sound Lake.
Concerned citizen of the
Concerned
county.
citizen, I am. And so I've actually gotten asked a fair number of times sort of how I fell into this. And so I happen to be an EMS physician. There's a good partnership between Rensselaer County and Albany Med that has allowed me to, I have an Albany Med vehicle that I'm allowed to take out to calls and go help people in the field. that are critically ill or injured, etc. And Craig's story about the 3-year-old seizing is one of literally hundreds of heartbreaking stories that I could tell about the inadequate care and the suboptimal sort of EMS system that we have in this county. Some of those stories, like Craig's, got lucky and was a one-off or a near miss, we sometimes call that in medicine. A lot of those stories don't end well. And so I end up being the person that has to tell the mother or father, the son or daughter, the brother or sister, the husband or wife that somebody didn't make it. And know inside that maybe that could have been a different outcome. So that's how I fell into this. I also been a paramedic for about 20 years or so. I actually started EMS in this county and then et cetera. I have to be in a position where I was able to get the data of public safety for their dispatch times for everywhere in the county, which has allowed me to sort of analyze that on a wide scale and be able to look at the disparities between different places in the county. And so I can look at the response time, the town of Sand Lake, or in Poestenkill, or North Greenbush, or town of Hoosick, and be able to compare all those sort of apples to apples. And so that's allowed me to look at some of the problems. And so there's sort of 2 different levels of response in EMS. You need to get it, you need an ambulance to be able to transport you. Many ambulances in this county, but not all, are staffed at the EMT level, which is valuable. They can do some basic things. They can attach an automatic external defibrillator, or maybe help you breathe a little bit. They can splint your arm or your leg if you were to break it. But they can't do things like put in breathing tubes or analyze your cardiac rhythms or give you start IVs or give you medications or IV fluids or pain medication. You can imagine, you know, an elderly woman who maybe has fallen and broken her hip having to bounce down the road for 45 minutes to the hospital on excruciating pain, when that is something that in you know, this century should be a thing of the past. We should be able to treat that pain effectively, and it's just not something. And that's, you know, pain management is a nicety compared to sometimes other people who need much more advanced care that just don't get it. So the other half of it, besides getting the ambulance and the transport of it, is getting a paramedic to the scene who can do those advanced things. In different parts of the county, there are different problems. Sand Lake is pretty good. They have a paramedic level ambulance that responds pretty rapidly. North Greenbush is another example that has paramedic level ambulances that respond pretty quickly. Those both have the best response times in the county. East Greenbush has Bruin Rescue Squad, which is also paramedic level. Hoosick Valley Rescue Squad has paramedic level, and then the city of Troy. Outside of that, it's mostly EMT level ambulances, which are okay. Many of them, you know, try and do the best they can. But in a lot of those other communities, they have trouble getting paramedics to people on time. Some places, the town of Pittstown, for example, is as low as 16% of the time that a paramedic is requested, they actually get a paramedic. Poestenkill, I think hopefully everybody in the room is aware, and that's sort of why you're here, has a really particularly hard time. You're sort of centrally located in the county. There is certainly enough need here to get those resources, but not so much that it can be financially feasible to put a full sort of ambulance in this town full time, especially at the paramedic level. And so that's been a difficult thing from a economics perspective, from a political perspective, et cetera. And as a result, there's obviously over the years been some dynamics between adjoining towns and trying to get these services. As I've sort of worked through things, the best way, in my view, and I'm happy to have a debate or somebody else has a better idea of how to fix things, but the way forward that I see to improving EMS responses for everybody is to be able to share these services. So some of my, you know, the Sand Lake Ambulance Station, for example, is 3 minutes from the town line of Poestenkill, maybe 4. It depends how heavy of a lead foot you have, I guess. But the tragic thing is that somebody who, you know, gets into a car accident on 351 on the Sand Lake side of things will get an ambulance there in 3 minutes, 4 minutes, right? Somebody that gets into an accident On the Poestenkill side of 351, just over the line, another 100 feet farther, could be anywhere from 15 to 45 minutes before you get an ambulance, and you may or may not get a paramedic. And that's been going on for a long time because you get whoever you can get at the time. And
Sorry not to interrupt, but just to be clear, it's illegal for us to respond to the town of Poestenkill. It's not that we don't want to. In fact, we do, but every time we come here for a critical patient, which is what we say we'll do, we're actually breaking the law. And so we've been told by the state health department that we shouldn't be doing it. So, you know,
yeah.
Just to be clear, it's not for a lack of will, it's a lack of.
And so the solution to many of these problems, I think, is for agencies to work together sort of across these town lines. And so in some of my other presentations, I put up sort of the full sort of financial analysis that I've done, but I've sort of looked at the costs of an ambulance, of a paramedic level ambulance, and how many you would potentially need in different areas. And if towns were to share those services, if you can, because transporting people does generate some billing revenue, hopefully primarily from insurance, is the goal of that. And if you offset that from the cost, whatever's left over gets shared between different communities, more or less based on what their fair market value of their housing, et cetera, as a representation of both a balance between the population in any given town and sort of people's ability to pay for those services. It sort of works out in a fair way, in my personal opinion, to sort of share the cost of this service. And then we can break all these lines that honestly shouldn't mean anything, but unfortunately do in the current situation. So I've been working around and having a lot of conversations about this sort of stuff. Fortunately, yeah,
Could you just briefly summarize the response time data that you collected from last year?
Yeah, so just to give you guys, so this is the 2024 data. So I have all the statistics you can see in here if you want to go through it all, and I can talk about the nitty-gritty details of sort of what it all means
For hours.
yeah, for hours. We can go back. But I think the couple most meaningful numbers on this sheet is there's something I have priority 1 or P1 dispatch to ambulance arrival, right? So this is the time priority 1 or P1 calls are calls where it's deemed important to use lights and sirens to get there fast. There are some calls where, the dispatcher gets the information and it sounds like it's a paper cut or it's a mild cough or it's something that maybe isn't deemed to sort of require an emergent response. And so I've taken all those calls out of this because I think the response times on that are less important. But the more meaningful ones are the ones where these guys are going lights and sirens to get there fast to somebody's house or wherever. So priority 1 dispatch to ambulance arrival. And if you look at the mean time in the town of Poestenkill, so this is the average time, 24 minutes and 54 seconds. So basically 25 minutes on average. So half the time an ambulance will get there faster, but half the time it'll get there, after 25 minutes, right? And so I don't know if your child is choking, I don't think you have 25 minutes for somebody to get there. And so flipping a coin on that is, I think, challenging. And you can look at the actual distribution there if you want to. Some are out as far as, close to 60 minutes. And then the other sort of powerful numbers are actually back on the first page. So I have priority 1 dispatch to ambulance arrival, 90 percentile. And so this is where 90% of the calls are less than, which means that 10%, 1 out of every 10 calls is over this. And so 37 minutes and 29 seconds is 1 out of every 10 calls has an ambulance that responds on what's considered a life-threatening emergency after 37 minutes, right? And so 1 out of every 10 people that are going to call 911 will get that sort of response currently in the system. And you can compare it to other places. So again, North Greenbush and Sand Lake have pretty robust systems. And that time for them, I believe, is somewhere around the range of 15 minutes.
It's 12 for us.
12.
So if 90% of our calls are less than 12 minutes. And the national standard is 85% less than 14. So we're pretty happy with where we're at. And our average response time is 7.5 minutes. My data is slightly different than yours, but
Yeah.
yours is 9, right?
Yeah, mine, yes.
Yeah.
Your average is 9. And
He's better at that than I am.
My data includes every response to individual towns, and so this includes the times when Sand Lake ambulance is maybe out on another call, and then North Greenbush ambulance or Boone ambulance has to come in. But the benefit that these guys have right now is that they're in a system. So if Sand Lake ambulance goes out on a call and there's another call in the town of Sand Lake, there's an ambulance from North Greenbush that will come to their last ambulance. There's ambulances in that town of East Greenbush that will come. Hoosick Valley Rescue Squad, which is all the way up in the town of Schaghticoke, but also has the same sort of agreement, will come to their last ambulance if they're requested. Hopefully that doesn't happen because that's a long ways to come. But because they're sort of in this system and willing to share resources equally between all of them, you have a much larger system of resources. And the hope is to get Poestenkill, which is smack dab in the middle of all this, sort of access to all these different services. Ideally, so I think in this system at first, it will likely be that Sand Lake primarily comes and then North Greenbush will come if they need to. I would love to push for a system eventually where it is simply the closest ambulance to the call location comes, right? That would be the dream. I don't know that can happen right away. I think this is the first step towards that. But that's what I would like to see. Because I want to see us do the best we can for every person. All right, I feel that I've talked enough. Does anybody have any questions on? Yeah.
For we who are not familiar with how this works.
Yes.
When we call 911, what should happen if everything goes right?
Gotcha.
And we've got an accident, we'll say, in beautiful downtown.
Excellent. Beautiful downtown Poestenkill. So what should happen is that a dispatcher should pick up the phone and they will ask you, what's the nature of your emergency? What is your location? And they'll ask you a few more questions. In this car accident, is anybody injured? Is there anybody that's unconscious? Is there anybody that's bleeding? And a few more questions. And they use that information to determine sort of how severe it is, right? So if you say, there's been a car accident, but nobody appears to be injured, then this is more usually a fire department or law enforcement matter. If you pick up the phone and say, there's somebody unconscious in the vehicle, they will say, send everybody, right, with lights and sirens to that location. So that process, and you can actually see the data for the town of Poestenkill in here for the mean call to ambulance dispatch time. That reflects the dispatcher's time. So the mean is 3 minutes and 52 seconds. It actually takes a little bit sometimes for the dispatchers to get through that information. That can be for various reasons. Ideally, if I can get a system in Rensselaer County, I can work on whittling that time down as well. But that's a different project for me later on. Once that happens, what happens is that the dispatcher hits some buttons, or actually the computer hits the buttons now, and tones will go off for Poestenkill Fire Department. Tones will go off for whatever responding agency. And so let's say that this goes through and Sand Lake is your ambulance. The tones will go off for Sand Lake, alerting them that they have a call at downtown Poestenkill. The ambulance crew will get in their ambulance and hopefully they either know where the call is or they'll Google it real quick or hit a button on their app, and then they will head to that call. In downtown Poestenkill should be a 5-minute drive from this.
No more than 5 minutes.
5, maybe 10 minutes, I guess.
I mean, I Googled from my station, from our station to the furthest corner of the town of Poestenkill, and Google told me it would be 14 minutes.
So that's what should happen. But let's say that there's already been another call either in Poestenkill or in the town of Sand Lake, right? So their ambulance is not on their station. There's an agreement already with North Greenbush ambulance. So instead of that, the dispatcher will already know that these guys are assigned to a different call, and then they will automatically dispatch North Greenbush ambulance to come to your call. And it would be the same sort of process.
So, what is the relationship between the fire department response and the ambulance response?
Great question. So fire department has our what's called first responder, BLS first responders, so EMT first responders. They also have different sort of priorities with things as well, right? So they show up and they certainly want to address sort of the scene safety, which everybody addresses a little bit, but they're sort of responsible for traffic control and all that sort of stuff. And then their EMTs will also come over and assess any patients. And so they can get things started. Again, if somebody's heart is not beating, they can do CPR and maybe apply an AED. But if that AED doesn't if a shock is not indicated, or if somebody say bleeding out, right, they can try and stop the bleeding, but they can't give back, for example, IV fluids or medications to try and stop the bleeding or things like that. And so at that point in time, they will wait for the ambulance to arrive. And so in this current system, and I've been on scene with these guys sometimes waiting for really, really long times for that ambulance to arrive. I will, in some of the systems that are more robust, what has happened over time is that the fire department, because the ambulance responses are much more brisk in other places and would get there basically at the same time, fire departments in some places have been able to cut back a little bit on some of the less severe calls to really only to focus on ones where they make a big difference, which allows the volunteers to really concentrate their time on cases that it matters. But that's up to the department here how they would want to handle that. Yeah.
So you're explaining, if this goes through, this is what will happen.
Correct.
And so my question is, what happens now? Because we have the fire department, we don't have an ambulance. You guys aren't legally allowed to come. Who is? Are we?
So
do we have nobody?
So there's no contract with any ambulance. There are 2 ambulance services that have what's called a certificate of need, or CON, for all of Rensselaer County. So Poestenkill falls within that. So those 2 ambulance services are Mohawk Ambulance Service and Ambulance. Ambulance has not done a whole lot in here. It used to be Empire Ambulance sold their certificate of need to Ambulance. Ambulance has not done a whole lot of 911 calls in Rensselaer County. Mohawk still does a fair number. Mohawk has different stations. So they have a station in Brunswick. They have stations in City of Albany. They have a station in Schenectady. And they cover many sort of different areas, as well as transports between hospitals or transports from the hospital back home. And so they have a fair number of ambulances, but they are, again, fairly busy. And so what happens currently is that when a call goes out here, the dispatcher at the Rensselaer County Bureau of Public Safety, the public, the 911 answering center, basically, will then call up Mohawk Ambulance and say, do you have an ambulance available to send to the town of Poestenkill? In 2024, 93% of the time, they would. Although, there's something hidden in that 93%, I'll also say. So, because they're essentially the only ambulance that can legally respond to this area, what will sometimes happen is they'll say no, and then the dispatcher will try and tone out other agencies. So they'll say, Sand Lake, will you come? And these guys say, sorry, we're not allowed to. North Greenbush, will you come? No, we're not allowed to. The town of Grafton has sometimes come over here. Again, they're not really supposed to, but in these situations, other times, the town of Pittstown Ambulance has come over if those aren't available. If that doesn't happen, what ends up happening is that the dispatcher will dispatch all these agencies, nobody will answer up, and then they'll call back Mohawk and say, any chance you have an ambulance available now? And they'll say yes or no, and then they'll go around again until they try, because they just keep on going until they find somebody who's willing to respond. And either at some point Mohawk will say that, yes, we now have an ambulance available to respond, we'll dispatch them, and then the Mohawk ambulance dispatcher is responsible for figuring out which ambulance is coming and giving that information. And so that's sort of the current situation. Sometimes it works out pretty well, but it's rolling the die, as I said, in that there's a lot of times where it doesn't work out very well. And because Mohawk doesn't have sort of the dedicated, they don't have ambulances that are supposed to be like dedicated to a certain area, again, because they're trying to optimize their efficiency by moving around the resources, it may or may not be where it could be helpful to the town of Poestenkill at the right time. Does that answer your question?
Absolutely.
Yes.
We've been talking about, thankfully, other stations responding when they're legally not responsible to. And Mohawk, for the fact that they aren't contracted, I would say are doing a job for us at the moment. With the responses happening from ones that aren't allowed to,
could there be a case from those towns where someone in the town starts bringing up legality issues where the town over there is forced to come for Poestenkill, either for just straight billing or additional things? Because we appreciate their service, and there could be a time, I'm sure Mohawk is successful, but there could be a time of unknown date that Mohawk either stops covering the area or has ambulances go down for service or whatnot, where we aren't covered. If these guys respond, is there a legal issue for Poestenkill?
So not really for Poestenkill, but for the responding ambulance service, potentially yes. Because they are coming and do not have a certificate of need, so they're not supposed to be billing patients. That's part of it. The billing part of things is like a whole separate side of things. Probably what the more significant case though is if they come over to the town of Poestenkill for somebody over here and something really bad happens in their own town, right? So a child is choking and goes into cardiac arrest or something like that, right? That ambulance service is now, and that town is potentially liable because they sent their ambulance somewhere else while one of their own citizens who, pays for that service and they have primary operating jurisdiction there, could potentially say, you use my resource to help them, but weren't here in my time of need.
Yeah, that was kind of the situation I was concerned about.
These are a little bit, what else, but it certainly could happen. And
So we have a solution, right?
Yeah.
Right. Well, we have a proposed solution. And so I think it's important to everyone to understand that running an ambulance service is very expensive. Tim and I do everything together. See, Tim's really good at people and I'm really good at math, right? That's kind of how it works out. So I spend a lot of time on the dollars, and about half, it costs about $900 to send an ambulance out the door. Just as we're just buying a new ambulance because our old one is getting too old, and it's going to cost us about $360,000 for a new ambulance. So every time we go out the door, it costs us about $900 in wages, in fuel, in paying for an ambulance, all the equipment we use. On average, we get about half that back in insurance money. So we bill patients insurance, and on average, we get about $425 back. So the other half in Sand Lake is made up by the taxpayers, right? The taxpayers pay for the other half of our bill. And so that works out at about $400,000 a year, which works out at about 45 cents per thousand on the tax roll. They don't have a separate ambulance tax in Sand Lake, but that's how it kind of works out, right? So the other thing that you need to understand when I explain how this proposal works is that 70% of ambulance calls happen during the day, which kind of makes sense when you think about it. People are out doing things, people are at home. People don't, unless they get out of bed at 3 in the morning and fall and trip and break their leg, don't usually need an ambulance at 3 in the morning. So most of our ambulance calls happen between 8 a.m. and 8 p.m. So the capacity that we have is, the proposal we have is to put on an extra ambulance to help cover the town of Poestenkill, but not cover it not at it 24 hours a day. So we would have 2 ambulances during the day and then 1 at night after 8 o'clock.
Yes.
And that would be enough for us to be able to cover all the calls in both Poestenkill and Sand Lake. And there's a ton of math that goes into it. There's a bunch of formulas on how many calls an ambulance can do in a day without getting overwhelmed. And, I follow that stuff really closely because I want to make sure that, the people in the town of Sand Lake are not getting caught out by, our ambulance being stuck at St. Peter's and then needing it. So I watch, how many calls we have to get North Greenbush to do, how busy. So we can comfortably do this with what we call an ambulance and a half, right? Which is 2 ambulances during the day and 1 at night. So the advantage for that is that we can contract with the town of Poestenkill for just to pay for that second ambulance, right? So it's only half the cost. Now, we do about 900 calls now, so there's only, we think about another 275 calls in the town of Poestenkill. So it's not gonna be half what the town of Sand Lake pays, because we have to make up that difference. So the proposal that you see is for just on $275,000 for the residents of the town of Poestenkill. And that works out, I said, Sand Lake pays about 45 cents. Our math, which don't trust our math, you can trust Warren's, but not mine. The residents of the town of Poestenkill will pay 47 cents per 1,000. And that figure, put that in front of him. We decided it's like $120 a year on a, no, it's not on that one. Yeah, a year on a $300,000 house. My garbage bill is $414 a year. It's been about 3 times that at Get Full. So we can, you know, I think it's a really good level of service that we can provide for you folks at a really reasonable price. Like, I realize nobody wants higher taxes. I certainly don't. I live in the town. I mean, Tom and I have had long discussions, and you know, we want to do this because it's the right thing to do. We're not doing it to try and make money or build a kingdom or do anything like that. We just want you guys to have good quality ambulance services, and we want to do it at a price that you can afford. And so we think this is the most cost-effective way of doing it. I mean, we can build an ambulance station and put an ambulance 24/7 in the town of Poestenkill, but that's $900,000 a year, right? So I think this is the smart way to do it. As Warren says about sharing services and sharing costs, there's really an economy of scale to this if we can build it, that we can keep costs down, which is important to everybody. The last thing I want to say before we can have a general discussion is, we've talked a lot about response times, and they're important, but it's also important about who responds, right? And you know, obviously I'm biased, but our guys are really good. Like, we take really good care of the people of Sand Lake, and I think it's important that you realize that you not only get fast service, but you get good quality service. And I'll throw Warren under the bus here with one story about not even a month ago, right? We got a call, and I happened to listen in, and it sounded like the patient was really ill, so I left my house and went with the ambulance crew to the house, and the patient was very, very ill. She had what's called a pulmonary embolism. She'd been traveling, very, very serious thing, but it's also one of those things that can look a lot like a heart attack, right? Looks very similar, and you could easily make the mistake of thinking it's a heart attack, and it's a different treatment. And also, more importantly, not all hospitals can treat pulmonary embolisms, right? So the first thing that I do is I call Warren and I say, hey, I think this woman's having a pulmonary embolism. And he says, yeah, I think so. It sounds a lot like it. And I said, she wants to go to hospital X. And he said, well, maybe they can treat it, but I can guarantee that our hospital can treat it. And we're not trying to sell you on one hospital versus another, but he knew that the people that needed to treat that woman were in the hospital, and he said, I'm going to make sure that they're ready for them when you guys get here. And so I hung up the phone and I says, okay, we're going to Albany Med because that's the place this woman needs to go. And then he called me back 5 minutes later and he says, I'm in my car and I'm on my way. And so this person got 2 paramedics, an EMT, and a physician within 15 minutes of calling 911. Warren has a little thing in his car, and I'm not saying this is a service that everybody's going to get, but this is what we try and do, right? Is he was able to confirm the diagnosis in the back of the ambulance. She went straight to the CT scanner, and then they were able to see the clot, and then she went straight to surgery to get it fixed. And we saw her 2 days later, and she was amazing. So, I mean, I just, you know, our guys take real good care of people, and that's what I want you guys to be reassured about. Yeah. We're open to questions. We want to have clarity. So
I have 2 questions.
Sure.
The first one is, if the proposed shared services between Poestenkill and Sand Lake goes through, do you have to enter into new contracts for mutual aid, or is there any impact on the mutual aid for more?
It's a valid question. So we've already had discussion with our mutual aid partners, and they're 100% supportive of us doing this, and they've said that they would continue. they would respond mutual aid to the town of Poestenkill without problem. So not only do you get us, right? So you get, we'll have 2 ambulances, Bruin has 2 ambulances, North English has 2 ambulances. So, you know, you're gonna get all of us to the last ambulance, including Tim and I at 2 in the morning, if everybody else is out. And I mean, that has happened, right? That they call me and say, there's no ambulances, and I drive down to the station and pick one up. That's one of Warren's like 20-minute response time ones, but that's, you know, so you'll get all of us.
Great.
Yeah.
The other question is about the cost and the budget,
Mhm.
because on the proposal, it
Yep.
says the first year will be 273,450.
Yep,
Which sounds like that's the cost of half the ambulance.
yep,
It also says that annual costs will be shared between the town of Poestenkill and Sand Lake.
yep.
So can you talk a little bit about what those costs are, or if you have estimates of what those costs would be?
Sure. So the conversation we've had now is obviously if we would prorate it for this is a 2025 cost estimate. So the town of Sand Lake is committed to this project too, but their cost would stay what they're paying now, your cost would stay what you're paying now, right? We've talked about what 2026 looks like and what we expect, like everything else, prices to go up, but again, we're committed to trying to do that as best we can. The one thing that I will tell everybody, and the one thing that keeps me up at night, is Medicaid cuts, right? Like, so the federal government has, you know, suggested, and again, it's all speculation at this point, that they want to cut Medicaid, and if that, I don't expect that to happen to affect us in 2026, but it may affect us in 2027. The last time that the state government had to cut Medicaid, they cut ambulance reimbursement in half. And so, you know, that would be, in our current budget, probably about $20,000 out of our budget, just like that. So again, it's my job to worry about that sort of stuff and be prepared for it. I don't know whether it's happening. I don't have a crystal ball on that, but that's kind of what I worry about. But to my sort of point that we're trying to keep everything under 2% is what I told Tom going forward, short of some disaster.
I also have 2 questions. One is priority. So we're going to be partnering really with the town of Sand Lake in addition to, like you guys are an independent not-for-profit,
Yes.
right?
Yep.
But certainly you have a contractual relationship with Sand Lake.
Yeah.
So how does the priority work, and how does the second part is how does Poestenkill have to collaborate with the town of Sand Lake to work out any contract issues?
Sure. So the first part of that is dispatch gives a priority to every call. So, and they use numeric alpha letters, Alpha Bravo Charlie Delta Echo, where Echo is the most serious. So every call gets prioritized like that. And so usually what happens is the first goes to the first crew. So if a call goes in Sand Lake, and then the ambulance goes out to it, and there's a second call, then another ambulance comes in. But in a situation where the first call is an Alpha and the second call is a Delta, they go to the closest ambulance will go to divert to the higher priority call.
So it's based on severity.
Yeah.
So it's not a difference between a Sand Lake resident and a Poestenkill resident. It's a difference on who is by the dispatcher felt to require, need the fastest or most.
But both geographic areas would be treated the same.
Absolutely.
Correct.
Yes. Yeah. And the second part of that is we're going to have we're an independent nonprofit, right? And we would have 2 contracts with 2 towns. There's a lot of things that can be done potentially with combining tax districts and doing but some of that is held up in this year's state budget. We shall see. But there is ways that you could do like a school district, right? And we have grand plans to solve all of Rensselaer County, right? We really do. And these are the sort of conversations we have about how we don't plan on stopping, if we can fix Poestenkill, and I mean that disrespectfully, we're going to try and fix everybody else too, because that's how stupid we are.
Yeah.
We're gluttons for punishment. But some of these sort of things come into play with shared services and shared tax districts and those sort of things. But yeah, absolutely.
So is Sand Lake, you said they're supportive of this proposal?
Yes.
The town?
Yeah, I've had multiple conversations, Tom's had conversations.
Why are they, what's in it for that?
So, go ahead, sorry. So you gotta understand, this is actually a financial win for us and a win for the people of Sand Lake, right? So there's two different things. For us personally, like, there's an economy of scale. I'm not trying to take more money, but we can do things cheaper if we're bigger, right? And there's duplication of services. So if we can get to a size that makes us sustainable, which is why I took this job in the first place, is to make this place somewhere that will not fall over again and would go on forever, right? And for the people of Sand Lake, they get 2 ambulances during the day when it's the busiest time, right? And no extra cost to them, right?
As does Poestenkill.
Yeah, absolutely, right? So the amount of times that it's 9 o'clock in the morning and there's 2 calls in the town of Sand Lake happens all the time. So there's a pitch to Stephen at the town is you get better service in the town of Sand Lake for free, essentially, and the people at Poestenkill get better service too, for essentially the same cost as what the taxpayers in Sand Lake pay.
I'll add on one more thing to that, and then so not only when you expand sort of the service to having 2 sort of ALS or paramedic level ambulances in town, the care that the sickest of the sick people get is also better because you can send 2 paramedics to that, and there's a number of different things that more advanced EMS systems are able to do when they have a couple of paramedics that are able to work together to help somebody who's really critically in need. And so I think it's not just a win-win from having more resources, but I think we can also provide even better care than what we're providing.
Yeah, so I'm on board. I know that we are today just having a conversation, but what does it look like to get this? Like, what do we need to do? Is it going to go on a special ballot, or is there going to eventually be a vote? How do we do this?
I can answer for you, but I'll probably be wrong.
Don't say it that way. Okay. What we're having now is a discussion tonight. We have another discussion up on the hill to listen what the people in East Poestenkill have to say. And then based on what feedback we get here, goes back to the town board, we make a move. That we have to follow. Our lawyers were gracious enough to outline what procedure we have to follow. And if it is acceptable, if the residents are supportive of this, then the board will continue to push forward and go through with this.
How do you gauge the approval?
Listen to what feedback we get here. Okay, listen to what feedback we get up on the hill. Listen to what feedback we get at town hall from people calling, from just communication. That's what we're trying to do.
I am in support.
I'm sorry, say it again.
I am in support.
That's very kind of you, sir.
I'm in
I mean that.
support.
Thank you very much.
Yeah.
Me too. David.
Just ask people, maybe raise their hand in favor.
I was
Would that be possible?
Yes, sir, David, it is. Thank you, David.
Was that a question or? Yeah. Maybe we can get the questions out of the way first and give everyone a chance to say whatever they want to say. So.
Sort of on the same topic, would it eventually be put up to a vote for both towns? Sand Lake would have to approve it?
No.
Poestenkill would have to approve it in a November vote, something like that?
So we're a private non-for-profit, right? So the town of Sand Lake contracts with us, right? We have made them aware because they do fund us, but they don't have a say per se whether or not we do move forward with this.
I'm confused. There'll be no vote
Not on the Sand Lake side, no.
on Poestenkill side.
No, we do not have to have a vote. We can vote by the town board, okay? If there is sufficient objection in the town, people would have to come through with a petition. And if they get enough signatures, we would have to do a permissive referendum. That's how we would come to a vote. The town board can do a vote, and Ian, our lawyer, has looked into this extensively, and the town board can do the vote but within 30 days. If the residents in the town object to it, they would have to go to a petition And then if sufficient people sign on for that petition, then we have to schedule a permissive voice. That's how it would work.
Is that, and I'm not a lawyer either, but I know how the town of Lake George, village of Lake George went through a similar process. So ambulance tax district ambulance funding is a little different than a lot of other things, but essentially what Tom says is that the town board can do it. The residents have the ability to oppose it, and if they do, they have signatures to oppose it, and then they'll go to a referendum and vote. But it does. The town board has done a great job in trying to understand these issues, to understand what the residents want, right? They really want to know what you guys think.
I got more.
Sure, please do.
I live off Columbia Hill Road, and first time that called 911 about a month ago. Ambulance took about 40 minutes.
Sorry.
Everything was fine.
Glad.
But I figured I'd share that one with the great people of Poestenkill.
Yeah, I think those response times are real. I think that.
I know I live in the woods, but
Yeah.
Well, yeah, and don't get me wrong, like, if you live way out in the east side of Poestenkill, it's gonna take a little bit longer to get there. That's sort of the reality of it, but I agree, 40 minutes, I think is too long.
That was a concern that I had, and I pressed Craig on it several times about farm ends in town, 50 Road, Plant Road, North Road, up in that area. I know they have Taberton on their side, and we have East Poestenkill, North Road, and so on, and there's a legitimate concern that the people, the residents up on that section of town would get adequate service, and that's what that was my prime concern. I know down here in the flats, they can be easily accessed by coming across 351, or coming up out of North Green, or coming up out of Winesville on 355. But up on the hill is a different story, and that has to be taken care of. That is, in 40 minutes is not,
Well, that's.
it's not acceptable.
Not having anyone at the Brunswick station.
And I mean,
Having them come from further away.
yeah. Mobile, to their credit comes, right?
Oh, yeah.
They just have a lot of,
They have a long way.
yeah, and they have a lot of other commitments. Yeah, so, did you have a question, sir?
Yeah, question, if maybe you can, share a little more information, right, because you talk about billing, right,
Yeah.
so soft billing, or is there any time you go to hard billing?
So
And obviously,
we,
now
so,
people are gonna be paying a tax for it.
sure.
But the other, then they're still gonna receive a bill.
It's a valid question. You are gonna get a bill, right?
Yeah.
So, and we do see people, so just to be clear, and I'll explain why, right? Because I think it's important to understand that we don't send people to collections that can't afford it. We send people to collections that don't want to pay, right? And so I get a report and I review all these cases, and if people come to me all say they can't afford it, then I just tell their billing company to not follow it up. What happens, right? And I teach this stuff, so I apologize if I get a little off track. Is New York actually has pretty close to universal coverage in health insurance, right? If you can't afford health insurance, you can get Medicaid, and if you have Medicaid or Medicare, which are the two federal programs, we don't send those people to collections. We don't charge copays. We're not allowed to. We accept what the government pays us. And just so we were talking before about that $900 that it costs us, Medicaid pays $230. So we accept that. The people that have private insurance and owe us a copay, or the other thing that happens is have private insurance and the insurance company sends them the check, and they're supposed to forward it to us, and they never do. Those people go to collections.
I can tell that bill is not $900.
Yeah.
I hit my deductible pretty early.
Yeah.
That's my deductible already.
So, I'm sorry, that's even, yeah. So, yeah, people that have, I understand healthcare is super expensive, and I would love to offer it to free for everybody, but we would be out of business in 6 months. And I hate to say out of business, but we would be closed, right? Like, you see our budget here, we're really careful with our money, right? We keep our costs as low as we can because we have to, right? We work on very small margins. Oh, sorry.
Yeah, there is a need for it here, of course, we know that. I'm probably in favor of it, but, your figure kind of, I might miss something. But contractor, the proposal is, $273,000 for the first year, which is about 68% of your budget.
Yeah.
Plus, on top of that, you're gonna take the building.
Mhm.
So, is that shared?
So the reason it's different, right, is because in the town of Sand Lake, currently we do 900 calls a year, and we get the billing revenue off that. We estimate we'll do 275 calls in the town of Poestenkill in a year, and we'll only get so that's a third of the billing revenue. Does that answer your question?
We're also purchasing a brand new ambulance, and so we have a reserve. We have one that's outdated, it's still operational, it's still functional, but running 2 crews 12 hours a day, God forbid something happens to one of those ambulances, you do need a backup. So there's $30,000 in debt services in the budget to help us afford that new ambulance. Otherwise, we wouldn't be purchasing it.
So, can I say one
Yeah,
thing?
please.
It's
So,
still a lot more, you take
yeah,
273.
Yeah.
That's 550,000.
Yeah.
Your budget's at 400.
No, our budget's not, no, our budget's not 4, our budget's not $870,000 a year.
I'm wrong, I thought it was like 410.
No, our current budget is, yeah, $883,000.
I think what you're talking about is how much they're getting from the town of Sand Lake. Is that the number you're referring to?
For some reason, I was told about $410,000.
No, that's, yeah, not even close, not even half, yeah.
Right.
Yeah, our payroll budget for one crew 24/7 is $640,000 just in payroll.
So let me just give a little bit of explanation on all this, because part of what I'm doing is trying to go around the county to forge these relationships, or at least have discussions, if I can, about ways of folks working together. And for this sort of what I consider a win-win for the town of Poestenkill and for the town of Sand Lake to sort of work out, what needs to happen is that Sand Lake already has a pretty good service in their town. They pay, a fair premium for that. What would be a very difficult political sell in the town of Sand Lake would be to say, we're going to raise how much you're paying for this to put on this extra half an ambulance because we want to go cover the town of Poestenkill at this point in time. And so really the way for this to go forward at this point in time from a political sort of nature is that the town of Sand Lake can't necessarily be paying more, but has to get some other win out of sharing services. And so that win is by putting on that second ambulance, which will, all the ambulances will then be shared. And so what that results in is that other daytime ambulance, the cost of that other daytime ambulance, staffing it, et cetera, has to come out of two sort of places, right? The money for it has to come out of the billing revenue, the additional billing revenue that can be generated in the town of Poestenkill, and from supplementation from the taxpayers. And so that's sort of why the numbers are slightly different. I will say, so I looked at, I'll give you the exact number. So the fair market, well, I won't say that. The contract.
Now, just not to, you go on talking about math.
The town contract rate that's proposed is $273,450 per annum. So the half of that for, prorated for this year. Which on a $1,000, per $1,000 of fair market value in the town of Poestenkill would come out to be 48 cents per thousand. Now there's the whole, assessed value versus fair market value thing. And so what that comes out to be, though, if you own a $300,000 house, that would be $145.25 for a $300,000 house or property. If you own a $500,000 house or property, that would be $242.08. And I had some comparisons, like the large coffee at Stewart's is once a week is $123, or a Netflix subscription is $215 a year. So, you're paying less than a Netflix subscription for it. I didn't punch those numbers for the town of San Luis.
But we're at 44 cents.
44 cents.
Yeah.
So it is a little bit less expensive on the Sand Lake side of things. At some point, could those numbers be evened out? Personally, I think that would be a fair thing to do. But I think for this politically to be something that gets across and the finish line has to be something that is a little bit of a lift on the Poestenkill side of things, at least at first. That's sort of how I see it, and I'm happy to have other, more vigorous debate about a better way of doing it. But sorry.
Yeah.
Sorry.
You started clarifying the fair market value. I want to just, I guess, make it more clear, almost a comment to some extent. That would be the evaluation of your house on your tax bill, which I believe for everyone would be significantly less than what your for sale value would be,
Correct.
Especially in markets that are fluctuating right now. So if you're thinking, oh, I could sell my house for $500,000, that isn't what the town is taxing you on necessarily.
Right, it's the assessed, yeah, so there's an equalization rate, like what you're assessed at is like, I think in Poestenkill, 16%.
Yeah.
16.61% according to, you can look all these numbers up.
And I'm sure it'd be anecdotal. I doubt you have the data broken out to this level, but we would be, in gaining this service, gaining essentially access to 2 active ambulances or shared.
You're actually going to get 6 during the day.
Okay.
Because you're going to get,
Although you don't, again, probably have the numbers in front of you. We often think of, I call an ambulance for me because I'm having an issue, but are you seeing situations where there's multiple people that need ambulances at a time? Because that's something I think Poestenkill should consider as well.
Certainly most car accidents, there is
just a car accident or
a
fire or something.
Yeah, most car accidents have more than one only person. It's very rare that there's a single.
So that when we get these call responses, I'm assuming the first one is what it is. The second one may not get a response, or gets a response significantly less and stretches that service that shows up to whoever shows up. Is that something you're seeing as a problem right now, I guess?
I mean, the system is stretched in general, right? Like we're having this conversation because, every other community in the state and probably the country is having similar conversations, because it's healthcare is stretched almost to the breaking point, and EMS is stretched more than a lot of other parts of it. So
certainly, so there are lots of incidents where there are multiple calls going on at the same time. There's sort of a strange phenomenon both in the emergency department and in the pre-hospital environment, where for whatever reason calls seem to come in sort of in clusters. But what I will say is that the proof is sort of in the pudding. Again, when I analyzed all these numbers, both the town of North Greenbush and the town of Sand Lake have very similar response curves that are very tight peaks in generally 5 to 10 minute response times in most calls. And that includes the calls that the town of Sand Lake does all the way up at the top of Taborton. And so, you have access to these, and my hope is to continue to propagate this out into Rensselaer County, in which case it won't just be Sand Lake, the Sand Lake ambulance and the North Greenbush ambulance, but maybe a Brunswick ambulance and something from Berlin on the top side, that, we could just be sending the closest ambulance to you. That is my dream.
So I know we've got 2 people with questions.
Sure, hi. So my brother-in-law is a sheriff. I'm President Craig, and I come from a small town that had the same volunteer fire department ambulance, and I was shocked when I moved to this area, and I realized there were no ambulances in fire stations. I couldn't believe it. I was like, this doesn't make any sense. I associate an ambulance with a fire station. So then I know there's volunteer issues, there's staff, and there's all of that. So I invite everybody here to go listen to the EMS dispatch Rensselaer County radio.
It's pretty heartbreaking sometimes.
It is, like, at any given time, there are people paging for helicopters. ALS, this, and they're just beeping over and over and over again. It is heartbreaking to listen to. When I hear the sirens go off, I pop it on and see what's going on. I listen to it in the background while I'm doing things. So if you want examples of this, it is incredible. I call a sidewinder. He will tell you all about ambulances getting stuck at hospitals. Back up 10, sitting outside, can't dispatch because they're waiting for drop-offs. I've been to an ER in the last 2 years since COVID, spent 10 hours waiting to be seen in a hallway. I was in a hallway, everybody else was in this room where everybody was coming in, it's chaos. It felt like a third world country. I couldn't believe it, and I took a friend with tonsillitis to the ER, and they were there overnight. The guy next to me was there for 24 hours. This is medicine in the United States, so I invite people to listen to the radio. I have a question that's a little bit different. When did this break? What triggered, when did it go from 10 minutes to 30 minutes? What?
I don't know whether we have it. I don't know whether we have that answer for you. I really don't know. I mean, and I can't speak for Mohawk, who has been providing service to this town. But if the volunteers in your community will tell you how hard that it is just being a volunteer firefighter in this community, right? You know, the amount of work that's involved in training, the amount of times they have to get out away from their families in the middle of the night. It's a huge burden, right? It really is. And I have the utmost respect for anybody that volunteers in the community. The burden on volunteer EMS providers is, and I'm not belittling the firefighters by any stretch, you guys do an amazing job and you should be commended at all times, but the burden on somebody to be an EMT is astronomical for a volunteer to have to do. Just the training load, the fact that you can be stuck in the ER for hours and still have to go to work the next morning, the fact that you might get COVID, right? So that is really what has completely decimated the volunteer ranks in this county, I feel, is the combination of those three things. And that is really why I think that the ambulance service is already struggling. So you had a question too.
Yeah, I originally came from Calvin State, where they had county ambulances. What's the county's role in any of this?
So there's a couple of things that, how about I answer that one so you don't have to. There's a couple of things that you should be aware of. One, legally, so no municipality is legal. They have to provide fire and law enforcement to their residents. They do not have any legal responsibility to provide EMS, right? So, but when they do, because of the way home rule works, it is a municipal problem. And in this county, the county's position is it's a municipal problem and not a county problem. And they have stated multiple times publicly, including relatively recently, if anybody saw the back of my shirt on the newspaper recently, that they do not believe it is something that they should be involved in.
I'll give you a little bit more context on it here. So part of the challenge that we have in Rensselaer County is that we have so many different individual agencies with individual needs. So as I sort of started out, there's some agencies that still have volunteer EMT ambulances. There's some places that are, staffed 24/7 paramedic level ambulances. And because there's so many of these different ones that, and the needs are so different between all of them, the county's sort of a little bit of the worry there is that in trying to fix that, one community gets sort of harmed, or their service gets taken away. So it benefits one, but it takes away from another. And what they don't want to do is get into the middle of that circular firing squad, if you will. And so they're not opposed to participating in a solution. And this is the conversations that I've had. But it would have to be, all of the EMS community would have to be pointed in the same direction before something like that could happen. And so that's just sort of where we're at.
So can they be a source of grants?
So there are some New York State grants, which we'd have to see.
We have looked at.
And the county is looking into things like that as well. So they are participating in that. Could they contribute in other ways potentially? I think that, I'll be quite honest, I think what has to happen first is we have to fix some of these pockets, including, I think if we could get a shared service in the town of Poestenkill, I think that would be huge. I think you guys would be the poster child for how this could sort of move forward across the county, and you could really set an example. Poestenkill leading the way, basically. And I'd love to see something like that. And I think then maybe we could work on something, but I think without having had some larger success here first, I think it's going to be difficult to get too much beyond these discussions.
What's a realistic timeframe if there's support from the community in the town? Sand Lake is pretty much ready to, what will they take, and then the town, right? Are we talking months? Are we talking weeks? Are we talking?
So there's the town, yeah, I mean, Tom can answer part of that. From our perspective, there is this certificate of need thing that needs to go through the state. We've been told that takes up to 30 days. We obviously have to hire some more staff, but we could do it in 6 to 8 weeks, we believe, from when we sign a contract. We can start providing service, we believe. But obviously there's some stuff on Tom's side that starts with my understanding, at least, is the board doesn't want to make a decision that the town residents don't want to do. So this is what the meeting is about, is them understanding what your position is and what you guys want.
So Tom, what's a realistic timeframe from the town's perspective, if there's support?
Okay, if there's support, I think we could, let's see, it's end of April. I would like to try and get something going maybe by July, in July maybe. Maybe I'm being overly optimistic, but I would like to try, and I have asked Craig about that, about proration, and I was hoping July. But just to try and, again, feedback, listening, and trying to move forward. We have good people on the board and who listen. We have a great lawyer, and I think we are in a position to move forward. And like I said, I need to see what the people up in East Poestenkill have to say. And I'm going to say, please, my extension's 104 at Town Hall. Call me or stop in. But I think we could do something in July.
And that's realistic from our perspective too. So.
And I would like to say that these are difficult conversations for elected leaders to have, because they're and I appreciate the elected leaders in the town of Poestenkill that are sort of taking this on and willing to go out there and have these discussions and debates. And so I appreciate you. And
okay.
One more question, yes.
I'm sorry, excuse me for being rude.
It's okay. You're talking Poestenkill and Sand Lake right now, but yet you say Poestenkill and then another meeting in East Poestenkill, like we're divided.
No, I'm trying to reach out and listen to what the residents have to say. Just by having one meeting here, I didn't think that gave the opportunity for people across the town to come out and listen. So that's why we wanted to try and have a meeting where it's convenient for people to come to. That's all. I'm not saying that the people in East Poestenkill are totally different or second class or third class or anything like that.
I wasn't implying, I was just, you explained it.
Okay. No, I just want to make it convenient for people to come and talk. That's all we're trying to do.
That's on the 24th?
That's 23rd. 23rd. Next Wednesday. Okay, if we can, we'd like to try and do an informal survey as far as, are we in favor of continuing forward, or are we against the ambulance proposal, as we've discussed tonight? Okay. Okay, get raised hands, please. Okay. Time, please, time. Okay, if I've read this correctly, the vast majority of the room is in favor of us proceeding forward.
Yes.
Fred, please.
Thank you. I think what you just saw was the difference between 2021 and now. Because in 2021 for the referendum, I've said this before at the town board, we didn't know what we were voting on. It was to create an ambulance district with no details. What you and the town board have done, and the guys from Sand Lake have put together all the details. And I think you saw the result by this vote. Thank you.
Any other, okay, any other comments? Okay, I'm sorry, please, if you can.
The certificate of need, who would hold that, the town of Poestenkill or Sand Lake? It sounds like they're gonna do the legwork on it.
Well, okay, that I have to pursue a little farther, and I think Poestenkill would need to obtain certificate of need, and I've been talking with Ian, our lawyer, about that, and Craig was gracious enough to offer guidance on how to proceed and get that, but I think Poestenkill will need to get that.
So yes, so with the town, it's a ridiculously complex process for lots of problems, but the town of Poestenkill will hold what's called a certificate of need for the town of Poestenkill, which means they get to decide who provides ambulance services in their town. So if in a year from now you want to contract with somebody else, you have that ability to choose who it is, right? So we don't have that, we're not going to come in and say we're going to do it because we have to do it because it's held by the town, and it's held by the town in perpetuity pretty much. There's no cost to them doing it, and there's also no obligation. So towns can get a CON and then never use it too. So, but yeah, it'll be the town that owns it.
Other questions? Do you have any other questions?
No.
Thank you very much. Harold, please.
Would Mohawk still be able to be involved?
So Mohawk will still have a CON for all of Rensselaer County. It will be up to them. I think that, personally, I think it's, I think that they should, if there's a call. And to be quite honest, if they happen to be at this, driving through Poestenkill and a call goes out and they want to go to that call, and they're closer, I would support anything like that. I mean, I think what we're trying to do is provide a better service to the town of Poestenkill. We're not trying to push anybody out or eliminate anything, but just try and provide better service.
So Harold's point, if this goes through, that certainly would not preclude them from responding.
No, it wouldn't change anything.
No. They still, yeah.
They respond to calls and have responded to calls and said, like, not since Tim and I have taken over because they like to call us out of bed instead. But yeah, it's not, that's completely up to them. Yeah.
David, please.
And Mohawk could also do mutual aid.
Yeah, absolutely. Well, that's a tricky thing. I don't want to promise that.
I mean, they could if they were
available, right? Yeah. Only in that we don't have the ability to do mutual aid for them, so it's not quite mutual aid because we can't respond if Glens falls to do a call that they contact them. But if they don't even need mutual aid to come into Rensselaer County, they can if a call is, if they're asked to respond, they can go anywhere without if they need it. So.
To that point, although it's not officially mutual aid, it does essentially give us a bit more Mohawk availability as they may or may not be responding to some of these calls now as well. So it stands to gain that it does make them available more in some ways to us and the other ones that they sit in the middle of. I believe it was Berlin and somewhere. Right? So they kind of, the one that covers us-ish.
Yeah, Brunswick is really where their station is right now.
So it does kind of provide more for our town as well.
It provides, so what this does is it provides more resources to everybody that's part of the system.
Yeah, because this doesn't just get you us, right? And I mean, that's the thing that perhaps is not quite clear is it gets you North Greenbush and East Greenbush as well, right? So if there is a need for 6 ambulances in the town of Poestenkill, you will get 6 ambulances if they're all available, right? So you'll get them from all the other towns too. So, we're here all night. I'm happy to answer questions all night.
Please ask questions.
Yeah. So if you want to, I don't want to keep anybody that has other appointments, but, we're happy to talk this stuff all the time.
And thank you guys for coming and being active citizens in your community.
Yeah.
It's what we need.
Yes, to reiterate what Warren has said, we are most appreciative of you taking the time tonight to come out, listen, discuss, talk, give us feedback. That's so important and deeply, deeply appreciated. Seriously, we thank you very much. And as Craig has said, and Warren said, and I'm sure Tim will say too, if you have questions, please come up and we'll answer the questions. Otherwise, a very good evening. Thank you again. Thank you, Katie. Gentlemen, thank you.
You're welcome.
Deeply appreciated.
Thank you guys. Thank you for coming. Thanks for asking questions.